It's interesting in North America, and I'm trying to remember, I guess, I don't know, when did we get into our physical fitness craze? About 12 years ago or so, or 15, people started to jog, people started to exercise, and then right on the heels of that came a huge movement in holistic medicine.
Yes, it's a result of the electric environment, actually, because...
You don't mean electric. You mean...
I mean the electricity. Everybody feels together. We're all watching this program. Our bodies are all discarnate. We don't feel in touch with our bodies. So it makes us hold on tight and try to get in touch with our bodies through physicality. It's a Marshall McLuhan theory, and I've been studying
Oh, no wonder I don't understand it.
But it's really fascinating because something has changed in the past 15, 20 years.
There is now tremendous acceptance amongst people in North America, where before, if you did a show like this, people would go, oh, a bunch of quacks. I mean, these guys are, and then we've gone far from that. Now people are listening. People are saying, well, you know, I might give this a try.
Well, people are more and more dissatisfied with some of the health care, and also people are exercising their right to make sensible decisions for their health care.
It's a wonderful statement that one of the people you're going to meet, Sheila Pennington, has written a book called Healing Yourself, How Your Mind Can Heal Your Body, and one of the things we talked about, are we a health care society or a disease care society?
That's it.
And so far our medicine is based, and the only time people go to the doctor is when they're sick.
As a medical doctor, I know I was trained in the diagnosis and the treatment of disease.
Right.
But what I wanted to do was teach preventative medicine and self-responsibility. And what in North America, those two things have been separate up until 15, 20 years ago. In China, they do both. Here, we can do both.
You thought you had one pulse, huh? Ha, 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 ha. How many in there?
There's 6 pulses that we perceive. In Chinese medicine, we listen to the pulse, the rate, the frequency, the intensity, and the quality of the pulse beat. And through listening to this, we can determine energetically what's going on with the different internal organs, and then prescribe herbal medicine from there, or do acupuncture treatment, or make recommendations in terms of diet.
You practice some acupuncture?
Yes, I say that I do acupuncture, but I'm not an acupuncturist. I've done it for about...
Does that mean you just guess and stick, or you...
No, it's not that way.
Oh, okay. What does that actually mean?
Well, I've studied it for about 14 years, but I didn't get involved with the meridians. I know anatomical acupuncture and auricular acupuncture.
Auricular, meaning acupuncture around the ears?
Yeah. In the ear is a representation of the whole body, so that I can do a point here, and that's the lower spine, that's the neck, this is the knee, and I can go right to the point. You wound the body point in the ear with a needle such as this. It's a very tiny little dart, and it's put in, and in wounding that point, the body point is also stimulated. I can put a needle in the knee and put a temperature-sensitive paint on the knee, and the paint will change color. The knee increases in warmth.
Okay, yes. Okay, you're saying if you put the right needle here, it'll affect the knee, and you can actually see it through temperature change.
Yeah.
Okay, we have a tape to show you on acupuncture. Before we get into this issue, we're going to take a look at Carolyn Dean performing the stick pin acupuncture treatment. Watch this.
Okay. And this is a magnet,
so I can direct it in. And the
so
back
what I'm
end
doing
is
here is
magnet.
showing the patient one of these little needles that I've shown you on the TV. And you apply it in 4 different points. You can see it there very well.
I've had acupuncture, and I tell you, when it goes in the ear, you do gotta just a little. You can feel it.
Oh yeah, this is a cartilage, and it hurts. What the young lady is doing here is a big breath in and a big exhalation. I think it distracts people, really.
It does, yeah. I've had acupuncture in the ear, and that it is very sensitive because of the cartilage. But if you put the needle in here, it's the most incredible sensation.
Oh, it's quite painless.
Yeah.
But if you hit the right point, which you're supposed to hit all the time,
yes,
there's
that's
a
a good
numbing
idea.
effect.
Yeah.
David and I were talking. We don't do the electrical hookup of acupuncture needles that some doctors do. If you hit the right point,
yes,
you know it.
Yeah. They have now laser acupuncture treatments.
Yes.
Yeah. One of the 4,000 times that I quit smoking, I went for, and I'm not smoking, I'm still not smoking, but I went and had acupuncture, and it was a great help. I had to walk around with those things in my ears for a while, and and it did help the withdrawal.
Yes, that's what I'm doing up there. It's not laser. I do believe in laser acupuncture for deep fibrocytic problems, deep scarring of muscles, but I'm not sure about it for other conditions. I haven't used it or studied it.
If you're pregnant and you suffer from morning sickness,
Yeah.
raspberry tea?
That's right. Morning sickness, it strengthens the blood and gives energy. Very good.
Okay. Parsley.
For the kidneys, kidneys and bladder. You know, fresh parsley would be best, actually, taking a bunch of parsley, scalding it with a quart of boiling water, and then drinking that tea through the day.
Okay, that was my question. Do I need to make a tea from these herbs, or can I put a lot of parsley in my salad and eat fresh parsley?
Yes. It would be wonderful if people had herb gardens and could have fresh, live herbs. That's the best way. But then there's dried herbs you make in tea, and people encapsulate herbs because it's easier.
Right.
But the best is the fresh herb.
Nettles? Is that like stinging nettle?
That's right. Yeah, that's they're
Some
good
old
for
weed.
Yeah, that's right, in our backyard.
Right, and it'll cure?
Well, that's good for kidney diseases.
Huh.
Parsley good for bladder, nettle for kidney.
The North American herb traditions, did it come from our native Indians?
Yes.
They are the source of this wealth
Yes.
of information?
Yes, that's right.
I just want to, before we go to break, David, tell me what else you have here. This is cinnamon.
This is cinnamon.
Could I smell it? Does it? Well, it doesn't smell very strong.
No,
Scratch it.
no.
Just
Scratch it. That's like the old fingers on the blackboard. Does that drive you crazy? Oh yes, now I can smell it a little. Yeah. What's this for? Besides.
Cinnamon is very, very good for helping your kidneys in Chinese medicine, and very good for when your body feels cold inside. So it stimulates the yang energy in your body.
Is that if I just take the cinnamon that I have at home, and I put cinnamon in tea or something, will I get the same effect?
You will get some effect from it, but you see, Chinese herbs are rarely used singly. Usually it's a combination of things, because not only are you trying to treat one thing,
Right.
but you also don't want to suppress functions of other organs. You want to support other organs while treating a particular organ.
Okay, skull cap?
For sleep.
Never heard of skull cap. This is
Hops, valerian, and skullcap, and chamomile are good nerve herbs,
right.
and much better than Valium.
There
Good
you
for-
go.
yeah.
If you want to learn about these things, just stay with us. There are a couple of books that you can read. We'll tell you some sources. You could always go, I guess, to a herb store and ask, or to a health food store and start talking to the people, and they'd be glad to help you out. Thank you, David. Thank you, Carolyn. We're back with more in just a sec. I didn't mention